Hello, my name is Tiffany, and I am doing my presentation on how do women decide whether or not to get an abortion. The process of conceiving. Menstruation happens once a month, and it is when your body prepares itself for the possibility of pregnancy. One part of the menstruation process is ovulation. Ovulation is when your ovary releases an egg to get fertilized. When the egg gets released, it travels down your fallopian tubes to fertilize the egg. There are millions of sperm, but only one breaks through the egg. Obviously, this does not necessarily happen every time, as it's possible for no eggs to become fertilized, but in this case, only one sperm breaks through the egg. After the sperm fertilizes the egg is now called a zygote. The zygote then travels down the fallopian tube and keeps breaking up into about 100 cells that are called blastocysts. When the blastocyst attaches to the lining of the uterus, it is called implantation. After implantation occurs, the cells break up, some forming the placenta, which is what gives the baby oxygen and nutrition. Other cells develop into the baby. What is abortion? An abortion is when a woman who is pregnant decides to terminate the pregnancy. This is done by removing the fetus from the uterus. There are different types of ways to terminate the pregnancy, which I will talk about in the next slide. Different ways to have an abortion. One way to have an abortion is by taking medication. The doctors will prescribe two medications, one called mifepristone and the other called misoprostol. The purpose of these medicines is to induce cramping and bleeding, almost mimicking the process of a miscarriage. This causes your uterus to empty completely. Another way is surgical abortion. They do this by doing a medical procedure that uses suction to empty the uterus. The last one we have is similar to the surgical abortion, but they have to put you to sleep as it's more invasive. They give you dilators that are placed in the cervix the day before the procedure, and then the day of, you are put to sleep and the doctor sucks out and scrapes the remainder of what's left in the uterus. When can you have abortions? If you are taking the pills, you can do this up until the 10th week after your last period. If you are doing the surgical procedure, you can do this up until the 12th week after your last period. Now, while this is uncommon, you can have an abortion if you can find a clinic to do it between the 12th and the 14th week of pregnancy, which requires the more invasive surgical procedure. Abortions due to medical reasons. One reason someone may have an abortion is due to pulmonary hypertension. This is when the heart has to work hard to pump the blood to the lungs because the pressure of the blood vessels are too high. This causes complications because your heart is already working harder when you are pregnant, so adding an extra thing for your heart to work hard on brings complications. According to Everyday Health, you can go into bad heart failure and there is a 50% chance of survival. Another medical condition is ectopic pregnancy. This is where the fertilized egg implants outside of the uterus, in which the fetus can't survive outside of the uterus. If it continues to grow, it can cause major complications to the mother. Then we have preeclampsia. This is when the mother's blood pressure increases severely, causing damage to the other organs. It is said that the safest option in this case is to terminate the pregnancy. However, it is possible to continue the pregnancy up to 34 weeks if the mother is being closely monitored. Next, we have kidney disease. Now, if it's a mild case of kidney disease, then the mother still has a possibility of having a normal pregnancy if she's monitored. But if it is a severe case of kidney disease, it poses severe risk for not only the mother, but the fetus as well, some being life-threatening. The list of medical reasons can go on, but the last one I would like to inform you about is lethal fetal abnormalities, such as anencephaly, which is when the babies are born without their brains or skulls being fully developed, which results in death shortly after birth. Now we have gone through the medical reasons for some people having an abortion. Let's move on to abortion due to partner-related reasons. Some reasons include the partner being abusive, whether that be verbally or physically. Now, some would say, why don't you just leave him and keep the baby? This is easier said than done, because most of the time women are so afraid of the abusive partner that they are scared to leave or stand up to them or even call the cops on them. I have firsthand witnessed abuse and the women being too scared to leave. With that being said, the women, for the most part, do not want to bring a child into this world and have them endure the abuse from the father. Other reasons include the relationship not being stable or the partner being unsupportive or lazy. Having children is hard enough, but then having a partner who doesn't help or is unsupportive can make it just that much harder. This may then lead to constant fighting in front of the child or even a divorce. Lastly, the partner may no longer be in the picture. This ties into what I said previously about having children being extremely hard, and having to raise a child alone with no support is extremely emotionally and mentally draining, on top of the fact that they usually don't want their child to grow up without their father. There are other personal reasons some women have abortions. This includes not being financially stable, being too young, such as teen pregnancy, not mentally stable enough, or they are afraid of judgment, or even in some cases, their family or friends may get in their heads and may be telling them that they should not be going through with having a child and to terminate the pregnancy. Who do women consult? It is essential for women to talk to someone when deciding if they are going to have an abortion or not, as this is a life-altering decision. Not only is it a physical decision, but it is also an emotional and psychological decision as well. It is important to tell a parent, partner, or a trusted friend so they have the support when making a decision. The next step would be to talk to the doctor and confirm that the pregnancy is accurate. After this, there are many clinics or support groups to talk to that will help guide women through the process and offer the information and support needed to make a decision. Ultimately, pregnancy is a scary yet exciting thing in life, but can be scarier if you are not ready or you're having to make the decision to terminate the pregnancy. This is an extremely difficult and emotional decision to make, and making sure you are utilizing all the support and tools to help navigate you through this process is unbelievably important. Everyone's stories and reasonings are different. Regardless if we believe in abortions or not, we should respect a person's decision that they are making for themselves. Thank you.